Today I'm going to be performing a head and neck, lymph node, and thyroid assessment. So first I'm going to wash my hands and get 2 patient identifiers. So first I'm going to inspect and assess his head for size, shape, and symmetry. Okay. Can you turn your head to the left and right for me? And up and down. Okay, so now I'm going to assess his face for symmetry and size, so it looks good. And can you make some facial expressions? Can you smile for me? Can you frown? Okay. So now I'm going to feel your face to see if you have any tenderness. Is any of that tender? Okay. So now I'm going to inspect and assess the cranial nerves. So the first one I'm going to do is the CNV, which is the sensory. So that's here. Okay. And right here. Okay. So now can you raise your eyebrows? Can you show me your upper teeth? And your lower teeth? Okay. Can you puff out your cheeks? Okay. And now I'm going to have you close your eyes and hold them tight, and I'm going to try to open them, but don't let me open them. Okay, good. So now I'm going to palpate the neck, and this is going to be for symmetry as well. Okay. And there's no lesions or it's not discolored. And he can move his neck freely without pain. There's no pulsations. So now I'm going to do the lymph nodes of the neck and the upper chest. So we're going to feel these for size and symmetry. And we're going to do the ones right here on his arms too. Okay. Now we're going to palpate and auscultate the carotid arteries. And I'm going to listen to that as well with the bell of my stethoscope. Okay. Now we're going to inspect his jugular vein. So for this one, he would be laying down, but we're not going to do that for video purposes. And his jugular vein, if it was distended, I would see it when he was laying down, and I would move him up every time. So now we're going to inspect and palpate the trachea. And it is in the middle, so that's good. And it's symmetric, so now we're going to do the thyroid. So that would be right in here as well, and I don't feel one, so that's good. Now we're going to assess the CN, the accessory muscles, so that would be here. Can you shrug your shoulders against my resistance? Okay, good. And you're going to turn your head to the side and try to push against my hand. Okay, let's do the other side. Okay, good. So then I would document that he doesn't have any tenderness or headaches or anything like that.